Good afternoon. I'm Jennifer Gerson, VP of Marketing at MPS Credit Union and the President of the Pinecrest Business Association. Welcome to our member spotlight. Today, I'm joined by Nercy Radcliffe from Providence Healthcare Services. Thank you for joining me today, Nercy.
Oh, it's a pleasure to be here, Jennifer. Thank you for having me.
Of course. And thank you to the Miller Brothers for hosting us every week and for allowing us to spread the words about our members. A big thank you to Grant and Michael Miller. And thank you to Tommy for running the show and putting up with me every week. Nancy, tell me a little bit about yourself before we get into Providence.
Well, I have been a native of Miami my whole life. I was born and raised here. And I'm one of those people that has always lived in Miami, has never wanted to live anywhere else and wants to live here.
Well, we live in paradise, right?
Yes, absolutely. So I just love where we live. And that's why I'm so committed to our community and to just making this place the best place that it can be.
Right. It is, Miami is a pretty fabulous place. We've got a lot to work with. So, it's great for people like us that love to make the community better. So tell me a little bit about Providence Health Services.
Okay, so Providence Healthcare Services, we are a home health agency. We have been operating here in Miami-Dade County for 14 years. And our goal from the very start was to be a certified provider. So what that means is that we are a Medicare and Medicaid certified provider, and we offer services in all of Miami-Dade and Monroe County. And we're also accredited by the Joint Commission, and that's a big deal. The Joint Commission is the accrediting body that we chose. It has the most stringent guidelines as far as standards of care, and we're really honored to be a part of them. And really, that's a big deal to not only ourselves but all of our referral partners and the patients that we serve. And then we're also a 5-star agency, which is something that the Centers of Medicare and Medicaid rate. Mm-hmm. And so it's a big deal to be a 5-star agency as well.
That's wonderful. I mean, I'm assuming it's the same as, in banking, we get the 5-star Bauer rating. So I'm assuming it's the same type of, what's the word I'm looking for? Not rating, but there's got to be parameters in order to get that rating, correct?
Yes, correct. So this is the Centers of Medicare and Medicaid, and what they do is they rate home health agencies based on different key indicators. So infections, hospitalizations, falls, different programs that you have in place. So it's a wonderful thing. It's very valuable, not only to the hospitals and the institutions, but also to the patients that are receiving care at home, to know that their agencies are rated highly.
You just mentioned a keyword, home. So for those that don't know, what is healthcare at home?
And that is a great question, because healthcare at home, there's a big shift in our country to providing healthcare at home, Jennifer. And there's more and more of it that's taking place, because what we've learned is that, today with technology and with devices and equipment, we really can provide care at home very safely, very effectively. And really, it's the best thing. It's the best thing for the consumer. It's the best thing for the providers. It reduces risk. Again, not just to the patients receiving care, but to the providers as well. It's the best place to be. At the end of the day, we all want to be at home.
Right. I think it provides just another layer of comfort.
Exactly.
I don't want to call them the patient, for the person that needs the care, right?
Yes.
I think that aspect of being home and being in your familiar surroundings just adds an extra level of comfort instead of being in a place where you're not necessarily so comfortable with.
Yeah, no, absolutely. I mean, we all want to be home as long as possible. I think that's all of our goals. And even our families, that's what we find, that most individuals want to keep their loved ones at home as long as possible.
Right. And, thank God for companies like yours. I'm starting to be in this position with my mother, and there's only so much we can do as family members. We need that third arm to rely on, or that other group of people to rely on to provide the care that they need. Because when it comes to our generation, we're working full time. We have children. We're doing everything else that we need to do in our nuclear family. But now the tables have turned, and we need to take care of our parents or our grandparents. So It's wonderful to have these options to assist, when needed.
Yes. And Jennifer, you have no idea. I mean, there's not a day that goes by that we don't get calls from family members just as yourself, that they're just so burdened with all of life's responsibilities and taking care of their children, and at the same time knowing that they have to do right by their parents and they got to take care of them and be there for them when they need them. And
it just adds that extra element of why we can't sleep at night, right?
Yes, and it's very stressful, and that's what we're here for. We're here not only to help the patient recover and regain their independence, but to provide that comfort and peace of mind to family members as well.
Yeah. And, from a firsthand basis, this is confusing at best when you're starting to figure out all of these home health care services. So who pays for it? And then, and if they have insurance, does insurance cover it? What are the different options when it comes to home health care?
Yes. And oh my goodness, that is a loaded question.
It really is.
Yes, it is. Because I know how difficult it is to understand and navigate our complex healthcare medical system. And so I think the most important thing to understand is that most home health care is primarily paid currently by the Medicare program, because it is for a homebound elderly population. And so it's covered based on need, and it's typically covered, post a hospital stay or an illness or some sort of a facility or institutional admission. They're getting discharged back home, and it's with a goal. It's with a goal of restoring their health, and it's paid by the Medicare program. But then there's also the Medicaid benefit, and that is really for recipients of the Medicaid benefit that qualify based on either income level. It's really for the underserved, and then also for those with disabilities. So we actually have a wonderful program in our state that we take care of individuals with disabilities. But that Medicare and Medicaid both are paid, but with doctor's orders. So again, there has to be a need, a clinical need. It has to be authorized, ordered. But then there's also a lot of different commercial plans. Like you and I, if we end up in the hospital, then we may have home care covered under our commercial or our employer-sponsored plans. If we also qualify that for a temporary, time frame, we're at home and we're considered homebound.
Right.
It's less rare because typically you and I can go out into the community to get the services.
Right.
But again, it's based on need. And then there's also long-term care. One of the beautiful things under the Medicaid program is that those that qualify, again, based on need, are able to receive long-term care services through what's called the home and community-based waivers. And that is a wonderful thing as well to, add additional assistance in the home. And then, of course, there's all the private policies. So you can always pay for it out of pocket, or if you have a long-term care policy that you've invested in, then those pay for the services as well.
So the difference between Medicare and Medicaid, I know you touched on it. So it's Medicare is more of an insurance-based paid program, and Medicaid is more of a needs-based program that's provided to you if you need it.
Yes, that's a great question. So Medicare is the health plan that everybody in this country, once you turn 65, you have Medicare. There is no other health plan. Once you turn 65, it's the Medicare benefit. You have to qualify, and again, it is all the services are covered if you have the need and you have your doctor order it. Medicaid is really only for a certain segment of the population that qualifies, either based on need, financial need, income need, or based on disabilities.
And so it's probably confusing at best, right? So do you help people enroll in the insurance that they qualify for?
Yes, actually, that's a great question as well, because we actually do. With the Medicaid long-term patient, and we find when we go in and we do an in-home assessment and evaluation.
Is that step one?
That's the step one. That is definitely step one. When you have a referral from a referral partner, a hospital, a discharge planner, we send out a nurse to do an evaluation. But if we determine that they qualify for long-term care, then we actually help them enroll and just help them. We kind of guide them through the process. It has to be done by themselves or their family through the Alliance for Aging, but it's a very confusing process, and it's something that it's long, it's tedious, and so we really just hold their hand and walk them through it, and we stay closely connected with them until they get that long-term care service, and then they have additional services through long-term care.
And is it a fair assumption that you work with these plans? If you help them enroll with the plans, I assume you work with the plans.
Yes, we actually do. We work with all of these plans that I have mentioned, with Medicare beneficiaries, with Medicaid long-term care, We also are contracted with many commercial insurance plans, so we're able to service a lot of members of commercial plans. And we certainly work with, long-term care and private cases as well.
So how does a person get the services if they need them? We just said step one is like the in-home evaluation, but what is the process that the patient or the family needs to go through in order to get the home health care for their loved ones?
Okay, so typically, first of all, I'm very thankful that in our country we still have something called patient choice. So the patient always ultimately has the right to choose their provider, and they could get the services from us per se if they desired to. Like even if they are in a hospital setting and they're referred to another provider, they can always say, "Oh, they have that choice." But typically, our services we receive them again with doctor's orders and from hospital settings. So we collaborate with many different facilities, rehabs, hospitals, discharge planners, case managers, who are very interested in getting these patients integrated back in the community, restored to health after, again, a hospital stay, an illness, any type of rehabilitative treatment.
So this can be short-term or long-term.
Yes, exactly. And so then that's typically where we get our referrals from, unless, of course, those individuals then also have additional services that they need and they're paying for them privately or through other funding sources.
And is there different levels of services? Is there more of just companionship and then medical related services?
Yes, there are. And just today I had somebody call me and ask me that question actually. But the levels of services are really totally based on who the payer source is, what they're authorizing. Ultimately, that's what it really truly boils down to. Even with a home health aide, for example, there's so much confusion. What do home health aides do in the home? And it really depends. If it's a Medicare a patient that is getting services in the home for a very short period of time, and that is our goal, is to get them better soon, because that is the best thing for all of us, for the medical system and for our land. They are only going to be receiving home health aid services that are, it's basically personal care, everything having to do with their personal well-being, warming up their food, making sure they're bathed, maybe doing laundry, light housekeeping. But if it's a Medicaid plan, for example, a Medicaid long-term care plan, then they will authorize different services. They will authorize homemaker services, companion services, personal care services. And then again, if it's a private case or a private policy, then it really is up to that consumer who is ultimately making the decision. So that same home health aid, it really ultimately boils to who's paying for the services.
Right. So we started with the process, but then I interrupted you with that other question. So they have the in-home evaluation. What's the next step after that?
So the next step after that is then getting the assessment back into our office and determining exactly the services that the client needs, and finding them the right, caregivers that are going to be providing the care, and getting those out, staffing them, and getting those out into the home.
And then, so you just mentioned the caregivers that would, so what goes into what kind of caregiver is chosen? I guess it's based on what needs they have or what level of care they need.
Absolutely. It's again based on whatever was ordered by the physician or whatever the patient's specific needs are. I mean, we do our very, very best to also match our patients with the precise services that they need. If they need highly skilled wound care, then we're going to select those nurses that have, highly skilled capacities. Right. If they have a loved one with, Alzheimer's or other, dementia related disorders, then we're going to find caregivers that have certain certifications or, or experience in those areas. So it really depends on each individual case. We really evaluate every single case on a case by case basis.
Right. And I would imagine you need to. I mean, everything is so individualized and there's just different needs for everybody. And so I know Providence is very engaged in the community, and I know you have some special things coming up. So tell us about your events that are coming up and how you're involved in the community besides that.
Yes, definitely. Thank you.
This is the fun stuff.
It is the fun stuff because I do really enjoy working in the community. Like I said, I am a true native. I have lived here my whole life, and I'm always committed to just, doing my part to to make Miami a better place, and to hopefully have my kids feel the same way and want to live here all their life too, right? And one of the things that we do every year, this will actually be our 4th annual, it's called the Health and Wellness Harvest Festival. And several years back, we realized that we didn't have in Miami, I mean, other cities and counties seem to have, but in Miami, there was not one large harvest festival that focused on just healthcare needs, and a place where all the attendees could come and find out about all the different resources and all the different things that we have in our community that they may not know about and that they could benefit from. And so it's grown and grown and grown. The last time we had it, we had over 70 vendors, and this year,
wonderful.
Yes, this year we are working with again, it's in collaboration with Miami-Dade Parks and Recreation, and really the purpose of the event is to raise funds for the Leisure Access Foundation, which is that part of Miami-Dade Parks that really works. It's all those after-school programs that deal with children that have disabilities, and it's a wonderful foundation. And sometimes we think that it's because it's the county, they have a lot, but they really
they're stretched thin.
They're stretched
just like
thin.
Everybody else, they are just as stretched thin as other foundations.
Yes, and we are also we were honored that the mayor this year wanted to also be a part of it, and just plug in to it with the aging, the initiative on aging, which is so important to our mayor's office. And we are going to be, the event's going to be held on October 16th. It's at the Equestrian Center, which we are thrilled about because it's a very large area, so it can be very spread out.
Center?
It's at Tropical Park.
That's what I thought.
The Equestrian Center at Tropical Park, very open, very spread out. For
it's
safety.
A great location. It's perfect.
Yes, it's
so. I imagine you have sponsors for this event.
We do. We have sponsors, and we still have slots open for anyone that would like to be involved. Just reach out to us, and
so how do we find out about sponsorships?
So sponsorships, you could either call our office at 305-220-1088, or you could visit our website at www.providencehhs.com and just shoot us an email, and we'll make sure to get them the information that they need.
And what type of sponsorships are available still?
So really, it's all sorts of sponsorship. There's hospital systems, there's hospice providers, there's health plans, anything at all that has to do with health and well-being. Anything that's health related is.
And I would imagine that there's sponsorships for every level. So if you have a small budget or a big budget, there's somewhere where you can fit them in.
Absolutely.
I know I run a charity golf tournament. I think we've talked about this, and it's in 2 weeks. And, as last year, I'm sure you had to cancel the festival, right?
Yes.
Right. So we canceled the golf tournament last year. And this year I'm having such a great response to it that I've had to create sponsorships because I sold out. Oh, and it's a great problem to have, right?
Yes, it is.
So I'm like, well, what's your budget? And then I'll, create some type of sponsorship for them. And it's been wonderful. I mean, the outpouring of people that want to come back out and support the community. And in our case, we support cancer. The people that want to support, our fight to cure cancer. It's just been amazing. And I'm sure you found the same thing.
Yes.
People are just chomping at the bit to get back out there.
I think people just want to be out. They want to be involved. They want to be out again. So absolutely.
And how else is Providence involved in the community? Are there other things? I know you come out to the business associations and you guys network, but I'm sure there's other things that you guys do.
Yes. So I'm actually involved in 2 different roles right now that I'm very, proud of. I actually serve on the Elder Affairs Advisory Board for Miami-Dade County. And then I also am very involved with United Way, and I also proudly serve on the Health Impact Council. And it's wonderful because with them, we're just always looking at ways to just really improve access to care in our community.
So important.
And currently those are the 2 organizations that, outside of networking, which we all do, and business functions, those are the 2 organizations that I'm just proud to say that I'm serving in and a part of.
Well, welcome back to the Pinecrest Business Association.
Yes.
I know she's one of our newest members that rejoined on Tuesday at our fantastic luncheon. Wasn't that luncheon wonderful?
Yes, it was fantastic at that great new place. Everybody's got to get out there.
Yes, everybody, you need to go to Platea. The food was delicious.
It really was.
They gave us a 3-course tasting meal for lunch, which we had a little bit of ceviche, we had some tostones, we had their amazing steaks. So it's where Payway used to be behind the Starbucks. It's a little tucked back there, but what a fantastic restaurant. Wonderful food, wonderful service, great people. If you're in the area, try them out. We all had a really wonderful time there on Tuesday. And upcoming in the fall for PBA in October, on October 19th, we have our 25th anniversary of celebrating the village of Pinecrest.
Oh.
We're going to have the current mayor and past mayors and the schools, and we're going to have a lot of people there. It's going to be a celebration to celebrate the 25 years of Pinecrest. In November, we're going to have our Thankful for Our Trustee Members luncheon event, which we'll all enjoy a nice Thanksgiving luncheon, and we'll celebrate, our trustees that really support the PBA and help us bring everything to you. And then, of course, we have our fantastic holiday party planned on December 2nd, which will be at the new Fred Astaire Studios in Pinecrest, Palmetto Bay. We're doing it joint with Palmetto Bay. If you are interested in being a sponsor for the holiday party, we have all levels of sponsorships. Reach out to me. Everybody knows how to find me. You can comment, you can email me, call me. I'm always available. And we look forward to seeing everybody throughout the fall events. Thank you again for joining me. I'm so happy that you were able to fit it into your schedule today.
Absolutely. Truly a pleasure to be here. So thank you for having me.
And thank you everybody for watching. We'll see you next week at 1:30. Thank you, Tommy. And have a great week, everybody. See you next week. Bye-bye.